Hello, everyone. Happy Friday. We hope that you were doing well today was actually dry, but it's been kind of wet here in California. We're gonna get started in just a second. We're gonna show you a quick video, then we're gonna make introduction. This one. All right. Share.
Hello everyone and welcome to today's session. We are PreMed CC, a student-led organization established in the fall of 2021. Our goal as an organization was to create an online community for pre-medical students at community colleges and universities with the hope of guiding the next generation of diverse and inclusive physicians.
And while we advertise our organization as being for community college students, our events are open to anyone. We realize that finding guidance and mentorship in a pre-med journey can be especially challenging for first-generation pre-med students, people that lack the financial resources, or just those that do not know people in the medical field.
One of the best parts about our events is that they're virtual, so you can do it from the comfort of your own home. We typically have events on Fridays from 5 p.m. to 6 p.m. PST, and on Saturdays from 10 a.m. to 11:30 a.m. PST.
If you aren't able to attend the event, all our sessions are uploaded on our YouTube channel. Many of our sessions will end with Q&A with our speakers. Any questions that you have can be put in the Q&A section on Zoom, and our team members will read them and have them answered.
After you have attended our event, you can log on to our website and complete the quiz, which will contain questions pertaining to our session today.
If you score 70% or higher on the quiz, you'll be awarded a 2-hour mentorship certificate to show that you attended our session today.
If you want to stay connected with our upcoming events or want to tell your pre-med friends about PreMed CC, you can find us on Facebook, YouTube, Instagram, and TikTok at PreMed CC.
Hi everyone, let's welcome Dr. Heena Panchal. So Dr. Panchal is a double-boarded psychiatrist and family medicine physician. She is the chair of wellness for the family medicine residency and the director of behavioral health for family medicine residency at Kaiser San Jose, where she leads integration of behavioral health within the residency curriculum. At Kaiser, she also precepts and supervises residents with both family medicine and psychiatry cases and serves as a communication consultant co-lead, where she helps train physicians in empathetic, patient-centered communication skills to improve the physician and patient relationship. Before working at Kaiser, Dr. Panchal did her residency training in a 5-year double-board residency program in psychiatry and family medicine at UPMC Western Psychiatric Institute, did her medical school training at UC Davis School of Medicine, and undergraduate training at UC Berkeley.
Great. Is it my turn to talk? Okay, great. Thanks, Edith, for introducing me, and I'm grateful for Jubin for everything that he's been doing for the PreMed CC organization and all of the team there. Such important work. So I'm happy to talk today, this evening, and I guess I can just start with just my journey with what it's been like for me, and then I'd love to open it up for questions so just we can have an interactive dialogue. So I started at UC Berkeley, so that's where I did my undergraduate training, and I trained in molecular and cell biology with an immunology emphasis, and with your major, but whatever you decide to do, it honestly doesn't matter too much. So you just basically want to do whatever you're interested in. So that's what I did. I was really interested in science and biology. That's why I chose that major. And then I ended up having a really profound experience, I think, in research, and that was at UC Berkeley. I joined a laboratory, and it was headed by Paola Timoris. She was my research mentor at that time, and she was an amazing Italian woman who got her PhD and her MD PhD in the 1920s, and went through the World War and just so many different challenges that came with that, and escaped from that. I apologize, my connection's a little bit unstable. Let me see if you guys can hear me. Sorry about that. I know my connection's just a little bit unstable. So I apologize if I get cut off for a little bit. But what I was saying was she was a really inspiring, oh, good. So she was a really inspiring woman and really encouraged me to flourish and kind of lead research and do what I was really interested in. So I was really interested in the effects of turmeric, which I'm sure you all guys, all of you all know about curcumin, and just the anti-inflammatory and anti-cancer benefits. So I spent a lot of time researching that, and we did some genetic testing to try to figure out like the effects on genes, and just had some profound anti-inflammatory and anti-cancer benefits. And so I ended up doing some publications on that. And I applied to medical school the first time, but I didn't get in the first time. So for those of you who are applying to medical school, don't feel discouraged if you don't get in the first time. What I did at that point was I took it as an opportunity for just self-reflection and just trying to figure out other ways for growth and see, like, if there were areas that I was lacking in, what I could improve in. And so I ended up thinking, oh, I really like research a lot, and this is really fun. And just with the mentorship of Dr. Paula Timoris and all that. So I decided to take a year off. I did a few things. One was I took a year off after UC Berkeley, and I ended up doing some more research in a stem cell laboratory. So I took an elective in stem cells, and I found that really interesting. So I joined a stem cell laboratory and did research on there, which was really amazing and profound and really cool, experimenting on that. And then the other thing I did was I ended up I wanted to kind of see what it was like for one, as just to solidify my interest in medicine and see if that was something I really wanted to do, but also just to gain experiences with other cultures and just get a better understanding of what it's like for medicine to be practiced in other areas. And then also just to be inspired. So I ended up doing a global medical brigade, and I ended up going to Honduras, and this was a really sustainable program. And so they have like a clinic there, and they have services with like native Honduran doctors, and I got to be a part of the brigade and help out there, and it was just so amazing and inspiring and refreshing, and I found it to be really rejuvenating. So then I ended up applying again and to medical school, and this time I was like, oh, you know what, I really want to do the MD PhD programs because I really love research and this is so fun. And I ended up applying. First time around, I applied to like 40 medical schools, right? Just huge amount of medical schools. This time I'm like, you know what? I'm just going to apply to 8 medical schools only. And I'm only going to apply to California because that's where I want to be. And it was just super risky, right? Because the first time I applied to 40 and I didn't get in. So why would I get in for 8? But I was like, I don't really care anymore. I just want to do where I want to practice, and I want to do what I'm interested in. So I ended up applying to just the UCs and Stanford in California, and just for the MD PhD programs only. And it was a really fun experience. I didn't stress out about it at all, because you think I would be stressed, right? Didn't get in the first time, but I wasn't. And I just took it as an opportunity for growth. And I was like, wow, this is so cool, like interviewing at all these different research programs, MD PhD programs, and learning more. And I ended up getting into UC Davis at that point, and had a really amazing experience with Dr. Faith Fitzgerald. She was the person who interviewed me, but apparently she's just this inspiring woman in general. She's not alive anymore, but she runs was a big part of the internal medicine department back then. And she's like, you know what, Heena, don't do research because it's such a long track. And some of the people who've gone into the MD PhD program, they've been in it for like almost 12 years in medical school, just because you have to like do your PhD for a really long time. And I could see that you really care about patients. And, if you speed up the medical school process, then if you complete that and then you go on to the next stage, you can still do a lot of research while you're a physician. And then you can also do a lot of other things with the degree. And you can always subspecialize later. And there's always opportunities for research. You don't necessarily have to do an MD PhD. I said, okay, you know what, I'll do it. And so I got into UC Davis in medical school, super excited, right? Because I'm like, now there's some certainty in my life, and now I'm going to be a physician. And then I got really involved because I cared so much about patients and equal opportunities for healthcare for everyone and healthcare for all. I really started getting into advocating for universal healthcare, and Jubin was a big part of that too. And it was really empowering experience, just learning about what it's like in terms of healthcare access for a lot of us in the U.S. and not having good access to healthcare. And also, when you do get healthcare, sometimes it can bankrupt people, right? And it can be just super expensive, and not everyone can get it. And I had an experience with my own parents who technically, had really poor health care because they couldn't get good insurance. They were self-employed too, but they didn't quite meet the cutoff for like Medi-Cal or, and then they made a little bit more. So, and I was a poor medical student, so I couldn't really help them a lot. And sadly, my father died a few years ago, just because of difficulty with the preventative healthcare in getting that. So it wasn't just my father; it was, I think, a reflection of the whole country in terms of what they were struggling with and what it was like for them. I did the universal healthcare, really amazing experience being a part of Lobby Day. And it was just really an empowering experience. So I encourage you all, if you do end up going to medical school, just to do things that bring you joy outside of medicine. And that could be advocating for healthcare, but it could also be doing other experiences and just focusing on self-care as well. And, because it can be kind of a stressful period of time. After medical school, during medical school, I worked with some mentors who were dual boarded in medicine and psychiatry. And so that inspired me, and I decided, I really want to do holistic type of healthcare where I get to be a part of that mind-body medicine and really help patients with mental health and then also with their physical well-being. And I ended up deciding that was a path I wanted to do. So I ended up applying to the dual board programs. And of those, I really liked the Western Psychiatric Institute, UPMC in Pittsburgh. Really strong program that they had, and just super strong in terms of the psychiatry training as well as the family medicine training. I learned so much there. And I ended up continuing the global health experience throughout there. I did a global health track specialization during residency. And so during all 5 years, I was part of this program called Shoulder to Shoulder. And so I went back to Honduras every year, and I did this project where I trained the Honduran physicians on mental health care. And so they were primary care physicians, but trained them in mental health care. And so that way they could provide mental health within their communities. Because in Honduras, it's only one inpatient psychiatric hospital for the whole country. There's not really any great outpatient psychiatric services. So I thought this was a great opportunity to make a difference. And it was a really rejuvenating experience. And I really enjoyed being a part of that during my residency program. And then it came time, it was a 5-year program, so a long program, but fully integrated. And I became really competent in both family medicine and psychiatry. And then it was time to look for some jobs. And I interviewed at a lot of different places. And I decided to come to Kaiser because one, they were really accommodating and flexible in terms of allowing me to practice both family medicine and psychiatry. And two, they were just starting a residency program. So they hadn't started it yet, but it was starting to get lifted off the ground in terms of the planning. And so I got to be a part of that. And then I became their behavioral health faculty for the residency program. So it's been about 4 years now since that program has been in existence. And it's been such a joy teaching the family medicine residents in psychiatry. Shortly after that, coincidentally, a psychiatry residency started at our same Kaiser location. And so now we have a Kaiser residency in psychiatry and then also family medicine. So it's both of my specialties. And then I get to teach in both with both types of residents, both with the psychiatry residents. I get to teach them in medicine and psychiatry integration, and then with the family medicine residents, get to teach them psychiatry, behavioral health, and so and then I get to kind of flex in both. So I also precept the family medicine residents on medical cases, and psychiatry I also supervise them on psychiatry cases. And it's been really fulfilling teaching other residents and being a part of like making a difference in their careers. And then after that, I ended up becoming chair of their wellness program because wellness is super important to me and making sure the residents do well in that area. And so I've been leading that program. I also was an ultrasound champion at one point and just spearheaded that at Kaiser. Currently, I also do Ballant groups, so I co-facilitate that at Kaiser as well. And Ballant is also like these basically these groups that are focused on improving the patient-physician relationship, and they're really powerful. And then after that, I became a communication consultant. So communication consultants are basically chosen because they have like the highest patient satisfaction ratings for all their patients, and then they have like apparently great communication skills. And so I became that, and then I helped a lot with developing workshops for our colleagues, for our physicians that work with me, and just helping them feel more comfortable with different communication issues that arise when working with patients and improving that. And then as of this year, I'm now the lead of the communication consultant group. And now I'm also part of the regional communication consultant group for Kaiser as well. And I had a lot of training in motivational interviewing, and so I'm one of the experts in that. And so they've been kind of tapping on me to train Kaiser docs in learning more of the motivational interviewing techniques and reflective listening techniques. So that's been my journey overall. I think if you do decide you want to go into medicine, I hope the message I provide is not to give up. I know it's gotten super competitive nowadays, and the MCAT scores are, I don't remember what my MCAT was back then, but I know that that's changed a lot, and people are doing so many different things. And now there's a lot of competition to get into medical school. So if you don't get in the first time, I'd say continue to keep applying, because you'll probably get in sooner or later. And then take it as an opportunity for a self-reflection. If you don't get in, kind of look at like what are things that you can do to enrich your experiences and help you even strengthen the area, or even try to do more compared to maybe even other applicants to strengthen your resume. And then the other thing is, I think life has taught me resiliency, right? So you go through a lot of challenging experiences in life. Like for me, I lost my father 3 years ago, and that was a really profoundly life-changing event. But I just keep rising, and you just rise after every fall. And I think if you can use like a growth mindset in terms of how you approach life, that'll really take you a lot of places and keep you going. So that's me in a nutshell. But love to hear if you guys all have questions.
I can start us off with the questions. So
Sure.
Our first question we have is, would you mind elaborating on what you did with universal healthcare? And if you know of any opportunities we can get started in right now before med school?
Yeah, that is a great question. There's this organization, and I'm sure Jubin knows a little bit more, but it's called Physicians for Single Payer. And so they're this whole network of physicians across California, and also across the country too. I'm sure there's more of that everywhere, but they're basically an organization you can get involved in. And you can learn more about like what single payer healthcare is, which is universal healthcare for California. And there's opportunities to, Jubin posted a link. So that's the link. Encourage everyone to check that out. But you basically learn a lot about the issues that face us in healthcare and our patients, and what's important to them. And basically what I did was, so I was a part of this organization called the American Medical Students Association. So I was president of that chapter at UC Davis. And we were a part of AMSA is what they call it. And we were a part of that program. And then that program, the AMSA organization, provided opportunities to get more familiar with legislative advocacy. And so, and Jubin posted a link for that. Highly recommend checking that out. And if you join that, or if you join the other one, you can learn more about healthcare issues, and then get training in legislative advocacy. And so what I did was I worked with Jubin, and some of the other medical students, and we helped organize a big conference for that everyone in the country, not in the country, but in California could join. And it was a lot of different health professionals. So not only medical students, but nursing students and educators and a lot of different areas. And then areas in terms of the fields that they're from. And then we basically learn about single payer healthcare and what that's like, and the current situation of our country. And our healthcare is ranked really low right now compared to other parts of the country. I think back when I was doing it was like 37. I don't know what the number is anymore in terms of our healthcare ranking in the world. And then you basically learn skills in terms of how to talk with your legislators. So you learn how to meet them, and then you can meet with your senators and representatives, and then you learn how to devise like a speech and talk to them one-on-one, and that can help influence different bills that are passed. And so Senator Lino back then was the one who was trying to get universal health care passed. I think it was called SB 810, if I remember correctly back then. I don't know what the bill anymore is called, but I'm sure if you go on those websites, you can find that out. But I think they're still trying to do it. And then I ended up going to the senators there at the Capitol. We had a lot of medical students and health professionals. I think over 1,000, even more than that. And it was amazing. It was like a day where just white coats flooded the Capitol, and we were all there making a difference and advocating for our patients. So that's how you can get involved. And those are the organizations that Jubin posted there that you can be a part of.
The only thing that I would also add is that as a pre-med, you have a lot of things that you could do volunteering. So you could work for a state legislator, you could work in district offices. Also, this is an election year, so working on campaign is also a really great opportunity to do that. But internships, if you're close to either DC or Sacramento or any state legislators, but also each legislator has an office in their home district. So, and if you live in the U.S., you have a state senator, a state assembly person, a U.S. senator, a congressperson, and so there's a lot of opportunity you can do in your own district too. So you don't have to, go to a lobby day once a year or any of that things. You could also, do internships as well. So
yeah, and Jubin's
as a medical student, you don't have time, but as a pre-med, you have more time.
Yeah, and Jubin's a great resource for that. So he's done a lot of that, and he's connected to a lot of different politicians and people, and so great resource as well for that.
Okay. The next question is, how does a dual board residency training program work, and how does it affect how much of each someone would practice?
Yeah, so it basically, so the dual board program is it's a residency program that you do after medical school. It's a 5-year program, and there's about 5 programs in the country that offer it at this time. And there's only 2 residency spots per program. So at any time, there's only about 10 of us graduating every year. But it's a really nice program. It's fully integrated. Usually most of the programs across the country, you practice, you do family medicine residency rotations, and you do psychiatry residency rotations at the same time. And it's just fully integrated throughout like the week and throughout the year. And then you have elective time as well, so you can do other things. For me, it was global health, so that's what I made time for. You do get a little less elective time for that compared to if you just did a full psychiatry residency and a separate family medicine residency. So if you decided to do both of those separately, it would be 7 years total. But with the combined program, they've cut it down to 5 years. And then you get board certified. Now, I believe the double board programs aren't accredited, but that actually doesn't matter in this case because you are eligible and you can sit for both boards. So you would study for the psychiatry board and you would study for the family medicine board. But but what that accreditation means, it just doesn't have like a combined family medicine psychiatry board that you sit for. So basically, you sit for 2 different boards, and then you get certified in both, and you can practice basically independently in both psychiatry and family medicine, but you can integrate them in different ways. So once you get trained in family medicine, psychiatry, you're opened up to all the subspecializations too. I forgot to mention that after I did my double board training, I did even more training. So I did a fellowship in faculty development at UCSF for a year. I did a fellowship with American Academy of Family Practice and being a well-being leader for family medicine. And I did something else too, but I forget at this time. So I did some more fellowships after that, and that was really helpful, and it was kind of more skewed towards what I was interested in. But you basically get opened up to, you can do, after you do the double board 5-year program, if that's not enough for you, you can do more fellowships. So you can do you're open to all the fellowships in psychiatry, and you have all the opportunities for extra fellowships in family medicine too.
Right. Our next question we have for you is, do you have any recommendations for how to communicate well in the place we are in now?
Yeah, and then can you be well, when you say communicate, what do you mean by that? Like in which context?
I'm not completely sure, but they might mean well, I'm completely blanking right now.
I think there might be being a better communicator or
Oh yeah. Hey, have you guys heard of Toastmasters? So Toastmasters is a really great opportunity. I didn't do Toastmasters, but we have like a little Toastmasters thing in Kaiser where they teach us public speaking skills, and it's but I would highly encourage you guys to join Toastmasters if you can. And it's this organization where you basically learn public speaking, and then you practice a lot of that, and it's really valuable. If you can join that and then be a part of that, it can be really helpful to just in life in general. It might even help your interviewing skills too when you have to interview or like other contexts. And Jubin also put like a link there. So thanks.
yeah, and Toastmasters, it's off of like not it's not but if you're at a school, every school has a speech and debate team. They have speech and debate. They have also mock something.
Oh yeah, it's a good
And
point.
then they also have Model United Nation, and
Yeah.
they have them at all colleges. So you can do all of those things as well to becoming a good public speaker and public debater. So speech and debate is a little bit more topic based. Model United Nation, it's basically model. You play a mini UN, and then there's also something called mock something, and I can't think of it. If I do, I'll put it in the chat. But
Yeah, thanks for that, Jubin. Completely forgot about all those things too. So those are all great resources as well.
All right. Our next question we have is, how do you manage your time? Any tips or advice?
You know, highly recommend making time for self-care. So, you know, I always take time like after work to hike and go on walks. So usually walk about 3 to 4 miles every day. Make sure you eat healthy and you get good enough sleep at night. Try not to do too many all-nighters. And just take good care of yourself. And I think you have to make time for it for sure. If you just like don't have a schedule and you just do the work and just purely focus on like training and college and medical school, then things can catch up to you later in life and for your health. And so there's such thing as sleep debt, and so that can add up over time, and that can lead to chronic medical conditions later on down the road. And so just make sure you make time during, just like how you make time to brush your teeth, make time to do something for yourself every day. And so that's what you just need to do, is just make that time in your schedule.
Our next question we have is, well, they're just letting you know, I want to be a doctor, like a family doctor or a psychiatrist, but they don't feel smart enough. Do you have any advice?
Oh, that's a great question. You know, I think everyone's smart in different ways. I think you have to be really smart to get into medical school. And then once you get into medical school, super competitive, you know, but once you get in, I think going into different fields is mainly based on interests, like what you're interested in. So, you know, family medicine physicians have to be incredibly smart because they have to deal with like basically every specialty in one. So you have to know how to do obstetrics and gynecology, preventative care. You need to know cardiology conditions. You need to know nephrology conditions. You need to know pulmonary conditions. You need to know psychiatry conditions too, because you'll see psychiatry patients there. And you're the first line of contact. So if you're not well trained, then your patients won't do as well, and they won't get connected to services, and you might not be able to do as much. Psychiatry, I think, too, is again, a really important field, and there's a lot of things that you have to know to be a part of that. And so I would say all doctors are smart. There's not any dumb doctors or anything like that, but I think people go into different specialties based on their interests. And for me, I went into psychiatry and family medicine because I care about preventative health, keeping patients doing well. And I also love learning about all the different specialties. And psychiatry, I loved learning about communication skills, empathic communication skills, and learning how to diagnose patients. And then also helping patients at their most vulnerable state. So when patients have like schizophrenia, or they're homeless, or they're, really in the depths of despair, these patients don't have a voice a lot of the time. And when you are a good psychiatrist and you've done the good training, you can really make a difference in these lives, patients' lives, and help uplift them from these despairing conditions and help them live a good life. And so I saw these patients, and just like universal healthcare, I was like, I really feel bad for these people who don't have good healthcare, and I want to make a difference in their lives. I went into it with my heart, and I was like, and I see these patients with all these severe psychiatric conditions, and with schizophrenia and bipolar and all of the others, they have just a much higher mortality rate. And they also have a lot of other chronic medical conditions, and they don't get that care. Maybe they're judged or stigmatized. And so I went into it for those reasons. And so I would say try not to make overgeneralizations or stereotypes about physicians, because a lot of people go into it for different reasons. But it doesn't convey your intelligence by any means.
All right, our next question we have is, what did you do with ultrasound, and how does, I don't know if I'm pronouncing this right, but how does Valent work?
Okay. Yeah, that's a great question too. So ultrasound, basically, you can get training during your residency. I think in medical school, you can also get trained depending on where you go. But basically, you would use an ultrasound machine, and you can diagnose a lot of conditions. It's basically a tool, just like a stethoscope. And so you can, like if someone has had trauma to their, you can detect a pneumothorax, or you can see if there's a fluid around the heart. You can see if someone has a gallbladder problem. You can take measurements of a pregnancy or a baby or a fetus. You can diagnose, kidney problems, or you can, see if someone has an abscess on their hand. So you can use an ultrasound for a lot of different things. And so basically, as an ultrasound champion, I got a lot of training in medical school and residency. And so they said that, it sounds like you're a champion in this area. So you can train a lot of other physicians on how to do that as well, and help our residents learn that training so it can be helpful to them. And then Ballant is really different from ultrasound. So Ballant, basically, it's a group of residents that we meet with a group of residents. It's a part of their didactics curriculum, but it helps with well-being too. And basically, when you're in residency, or medical school, or even as a physician, sometimes you have patients that are really challenging, and they can be really emotionally challenging and complex, and sometimes they can stick with you. And this could include like patients that die, or maybe really angry, challenging patients that, don't like you very much, or, maybe other kinds of patients that have different kinds of communication issues or that kind of thing. And they just stick with you, right? You're like, oh man, this person made me really upset or really distressed. And what Ballant does is it gives a safe space where the residents can freely talk about the relationship between the patient and the physician. And so kind of explore that dynamic, and then it can result in a lot of empathy too. So we basically imagine what the physician could be experiencing, what the patient could be experiencing, and it can be a really empowering healing process. And so we do that once a month with our residents as well. But I think it's a part of all the family medicine residency programs, like it's a required part of it. Other specialties, not so much. So it depends on what you go into.
Thank you. Our next question is, what led you to choose your specialty, or in this case, specialties?
Yeah, I think for me it was when I was in medical school, when I did my family medicine and psychiatry residencies, I liked both residency programs a lot. And then my advisor, so they have a double board program there in family medicine, psychiatry. And so one of my advisors was dual board. And so I learned a lot about what that was like to do the program, and I got inspired. And then I wanted to do both because in I think in family medicine residency, you don't get a lot of psychiatry training. You might get a little bit. And then psychiatry, you do like 1 year of just like rotations in medicine, but I think that integrated piece is kind of limited too. And so I really wanted to combine both because I wanted to be really proficient in both fields and then also provide holistic care to my patients and help them with their mental health conditions as well as their medical conditions.
Our next question we have is, could you give an example of what it looks like to have a behavioral health and medicine integration in your practice?
There's a lot of different ways you can do it. So one is, if you decide you want to go to like work in an FQHC, you can be a part of like a consult service. So you can provide consultation as a psychiatrist or as a combined specialty physician to the primary care physician. So those are the ones that are a bit complicated. And then for me, the integration just comes in the areas I practice. So in my family medicine, so I have two different patient panels. So that means like the patients that I'm PCP for, and then the patients I'm a psychiatrist for. And then in family medicine, a lot of patients come with me and they have complex psychological issues. So it's not just like simple medical problems. And they need help with both. So I have the skills to help them with both. And that's where that integration occurs. And then on the psychiatry side, I'm also trained in the medicine part, so I can really help and make sure that patients, like if they have psychiatric conditions and they need medical help, I can help with that too. And then with the family medicine integration part with the residency programs, I basically help train the residents in both specialties. And so that's where that integration piece comes in. And I also act as a consultant to the residents for their patients that have psychiatric concerns.
The next question is, what advice would you give someone who isn't great at exams/tests?
Yeah, that is a great question. One is, just one is sometimes it could be a sign of an underlying other condition. So as a psychiatrist perspective, just make sure you're also being evaluated for ADHD. Sometimes that's underdiagnosed, and people have that, and they just haven't been tested for that. So, and if it's not ADHD, people have test taking anxiety too, so you can work through that. And see, how that's going. You can do prep classes too. I know there's different test prep companies for like MCAT and others that you can be a part of, and that can help you. And a lot of the time with test taking, it's all about strategy. So you might have the knowledge and that might be fine, but sometimes the strategy, you have to know about that. And so being a part of some of these companies, it can be helpful for that too.
Our next question we have is, are there opportunities you would recommend to learn more about or be more involved with family medicine or psychiatry integration?
I would say if you can find opportunities for shadowing, that's a good place. I know in medical pre-med, you can do shadowing with maybe different physicians in your area. So you might want to contact different clinics and then see if they accept medical students to shadow them, and then you can kind of learn what it's like. So I would say maybe shadowing would be a good place to start.
The next question is, do you recommend doing a master's in clinical or general psych before going into med school with the intent of becoming a family medicine slash psychiatrist?
All these experiences can be really powerful and helpful. I think if you did a master's in psychology, you definitely would get a lot of the therapy training. So that would probably make you a good communicator, and you'll know about empathic skills, which can be really helpful as a physician in general. And then you can do therapy. I think if you get a master's in psychology, I think you can't be a psychiatrist though. For that, you would have to do a psychiatry residency program or a combined training. But a lot of people do like masters and a lot of different things. So I know like MBA, business administration, that's a common one. You can do one in psychology. You can do one like you can become like a licensed social worker, which also gets a lot of therapy training, so you can become a therapist that way. And then some people do masters in public health, and so there's a lot of different opportunities to gain more experience in different fields before you even go into medical school, and all of that comes in handy, in the end when you're working with patients. Oh, there is a program I wanted you guys to be aware of. It's called Train the Trainers program. I think it was founded by some of the dual boarded family medicine psychiatrists in UC Davis. But UC Irvine has it too. And basically it's an opportunity for family medicine physicians to do extra fellowship training. I think it's 1 year additional training in psychiatry. So you don't get board certified in psychiatry, but you can become really competent in dealing with different psychiatric issues. And all family medicine physicians can prescribe psychiatric medications as well. And so if you decide you don't want to do like a full 5 year family medicine psychiatry program, that's something you guys can look into, is look into the Train the Trainers program, or doing like a psychiatry fellowship for primary care at UC Davis.
Our next question we have is, how would you recommend us going about getting mentorship?
Great question. I would recommend, I think for me, the way I found mentors was oftentimes it's the faculty that teach you. So if you have like attendings or faculty or professors in college, you can reach out to them, and if it's a subject that you're really interested in, you can ask them to mentor you or guide you in that. And then if you decide that you want to do like research, that's a great place, like in college. If there's professors there that you can be a part of a research lab, they can also be your mentor. And then with mentorship, you just want to be proactive as a mentee. So you want to reach out to them and then try to see if there's some goals that you want to work on with your mentor. And this could be career goals or other things. And then you can create like a plan with them, and they can mentor you in that area.
The last question we have open in the chat is, what books can I look at for the MCAT?
Oh, that is a good question. Unfortunately, it's been like a super long time since I took the MCATs, about 20 years. So I'm going to turn that over to you guys. Maybe Jubin, he might know, or maybe Edith or Nishita.
We've done a bunch of work. Like I think like the last 3 weeks, we've done a whole MCAT series. Go in the past events and look them up. We had done about MCAT, what to study. We also have a list of books that you could take a look at. I'm going to put that in the chat as well. But I think, yeah, because you probably took the old MCAT, right?
Yeah, super old one. Oh, was it?
With like chisels and pen. I'm just kidding.
Yeah, with
Chisels and rock.
Yeah, that's right. So I don't even know what the MCAT looks like nowadays or what that entails, but
The other thing is like your library, your public library has them, has the books available to you for free, and also your school library too. But school library, maybe a lot of other pre-meds have checked them out, but I know that for a fact, I was told by somebody, a medical student, then that's what they did. And I actually went to like the 3 libraries in my town, and I found like a whole wall of them, and they're free. I mean, you could literally just check them out and bring it home. So yeah.
yeah, that's a great resource. And then you can also ask like people above you. Sometimes they've already taken an MCAT and they don't need those books anymore, so they might sell it to you at a low cost.
But yeah, we had a talk this last couple of weeks, and all the videos are posted about the MCAT, what resources are available, all that good stuff.
Any other questions for me?
I have a question. Can you
Sure.
tell us what your day is, like what your day involves, and then also your week? Like,
Yeah,
do you do in service at all? Do you do out service? Do you
yeah, that's a great question. Yeah, so I basically like on Mondays I work in my family medicine clinic in the morning, and then in the afternoon I work in the psychiatry clinic. So I sometimes go back and forth. With the pandemic, things changed a lot with you know, telecare and virtual care coming into play. So a lot of our members like virtual care, our Kaiser members or patients. And so we offer that to them too. So sometimes I also have a good mix of telecare in my schedule. So I'll do telepsychiatry and with family medicine, it's just really hard to examine patients over the video. So most of my clinic day in the mornings is seeing patients in the office for family medicine concerns. And then I have 2 half days where I just teach the residents. So I basically am physically located in their clinics, in the resident clinics, and then they come to me and they supervise both family medicine, psychiatry cases. And so I help them with that. Um, some half days, I also work in the psychiatry residency clinic, so I'm physically located there, and then I'll supervise the psychiatry residents with their cases too. And then I have psychiatry clinic again. Tuesday, so morning I do teaching. On Tuesdays afternoon I do psychiatry clinic again. Wednesdays is an all-day family medicine day, so I do family medicine clinic in the morning, and then afternoon I do family medicine residency teaching. And then Thursdays it's family medicine in the morning, psychiatry in the afternoon again, and then psychiatry is it's all psychiatry on Fridays. So it's kind of a nice variety, going back and forth and just kind of switch my hats up a bit. And it's fun. It keeps the schedule interesting. And so it's not monotone or kind of the same thing every day. And then I do mostly all outpatient, but on the psychiatry side, I do help with consult liaison psychiatry. So that's basically providing inpatient services for medical consults for psychiatry in the main hospital, the medical hospital. So for that, I do like about two to three shifts a year, where for 7 days, I'm on call for the hospital, and then I go in and I round on patients on the weekend, and I see medical patients who have psychiatric concerns in the hospital. Consult liaison is really nice too. So if you decide you don't want to do a combined family medicine psychiatry program, but you want to do psychiatry more, and then you decide you want to do more of like the medical, if you do a consult liaison fellowship, that's a great opportunity to also get a lot of the medical training through that, because you have to consult on medically complex psychiatric patients in the hospital. So that's my schedule.
My other question is, so you don't do any inpatient, right?
No inpatient psychiatry. That's correct.
And then for your board certification, is it done at the same time, or is it every other, like you have to do it all at the same time?
Yeah, I did mine at the same time. I did mine was spread out by 3 months. So I did my family medicine boards first, and then 3 months after that, I did my psychiatry boards. And so it was, but I took about 3 months off after residency. I'm really glad I did that because I just had to move across country and come back to California and then study for the boards.
So you don't miss the snow.
I don't. I hated the snow. Sorry for those of you who live in snow country, if you do. Oh, the other thing, fond memories in Pittsburgh was one day it was like minus 20-degree weather. And so I had 5 layers of shirts and 5 layers of pants, and I wore a parka, and then I'd have to park about like, I don't know, maybe half a mile away. and then I had to walk in there, and my face would freeze. And in those moments, I had fond memories of that.
Yeah, I have a cousin who lives in Toronto, Canada. Um, and I remember one time I called him and he's like out of breath. And I'm like, what's going on? He goes, oh, I'm shoveling snow because I don't want my roof to cave in. I'm like, well, and my cousin, he's like in tech and he has a lot of money. And so
Yeah.
I'm like, well, why don't you just hire someone? It's like, man, when it snows here, you got to do it yourself because it's hard to find anyone to come and do it for you.
Yeah.
And so you just got to do it yourself. And so I'm like, oh. And I told him, be careful not to get a heart attack because there's this thing called heart attack.
Yeah, it happens.
Snowstorm heart attack is you go out there and you shovel snow and you work.
You get a heart attack. Yeah. I was just thinking that as you were saying. And you know, the other thing I remember too, so I had a lot of life and death situations in Pittsburgh, and that involves snow. And they don't do a good job of plowing the snow. So when you're on call on the weekend, I would drive in like 2 feet of snow for like 10 miles, but then my car wouldn't stop. So it would just slide right through the stop signs and the traffic lights and wave hello, just please don't crash into me. And so I learned how to ski with my car there. So I don't miss that either.
Yeah, no, definitely. And then when it rains like a half an inch in California,
Yeah.
everybody's like slipping and sliding down the road and
Yeah.
crashing. So it's like, you know.
I do have a question.
Yeah,
So you are double board certified in psychiatry and family medicine, and I just wanted to know, what are your favorite parts about both? Like, I know they're integrated, but what would you say are your favorite parts about both of them? Because they're both very interesting fields.
Yeah.
Interest in both of them, so it's just
Yeah. No, it's a great question. In family medicine, I love the preventative care aspect. So basically, doing motivational interviewing with patients and then really getting them to improve in different healthcare areas. So helping them change in terms of lifestyle and counseling. Oh, that was the other thing. So currently, I'm also doing a fellowship in integrative medicine. Forgot to mention that. So integrative medicine involves basically you're learning about like all the food is medicine, basically. So you learn like in-depth detail about nutrition sciences and how food works and all the important things about vitamins and all the things you don't learn in medical school. I feel like they should train you guys in nutrition sciences and integrative medicine in medical school because that's such a big part of keeping patients healthy. And I think it all starts with food and physical activity and lifestyle. And that's where that preventive care, if you're sound in that, then you're less likely to get other medical problems down the road and end up with other medical conditions. And I honestly think there's some pharmaceutical stuff there, right? And why does medical school curriculum not involve that when it's just so important? And why is it just focused on so much on like when patients get really sick, like how to treat them medically. And so that's what I like about family medicine. That's why I'm also doing the integrative medicine fellowship because I wanted that extra training. If you do decide you want to do a fellowship down the road, it would be Andrew Whale Integrative College of Integrative Medicine. So that's a great resource there to learn more. And then psychiatry, I love also that empathic communication and just getting time to do therapeutic interventions with patients and also helping patients feel better in terms of their psychiatric conditions, especially when it's really severe. And it's always nice when a patient is about to commit suicide or die by suicide and they don't, and they say, you know what, Dr. Panchal, when I was about to jump off that bridge, my husband yelled your name. And because of that, I remembered you and I decided I didn't want to go through with it. So that actually happened, true story. But I get a lot of that. And that's really powerful when you can like really save a life in that way. So saving a life just doesn't mean just being, cutting into things or, being a surgeon or, helping some of the heart condition, but it could literally mean like saving a life with mental health as well and preventative care.
Thank you for that. I really do appreciate it. And it is really impactful what you do. It's very impactful. I know that for a fact. We do have one question in the chat for you.
Sure.
They're saying, is it worth it going into medical school? I really want to be a doctor, but they don't want to do any more schooling.
It's a hard road. I'm not going to say it's easy. You have to go into it for the right reasons, and then you just really have to prioritize self-care and just say, like, I'm really going to prioritize self-care no matter what, meaning taking care of my health. And again, the physical activity, eating right, healthy, sleep, getting enough sleep, because if you don't, it can be easy to burn out. I'd say the burnout rate is really high in medical students in medical school, probably up to 50%. Really high number of women get sexually harassed in medical school. There was some kind of number statistic I saw, 50% of women, bad things happen to them. So I don't want to scare you all from that, but I just want to make sure that you know your boundaries, you know, like how to protect yourself, and then you also know how to take care of yourself. And then it's not about the money either, because you could always become a real estate agent or TikTok celebrity, or I don't know how people make money nowadays, like large amounts of money. But if you wanted to do that, you can go into something like that. But with medical school, you just have to do it for the right reasons and really care for the patient. And when things get really tough, just keep in mind, like, why did I go into medicine? And what were my reasons? So just make sure you do that, because it is a hard field, and it can really take a toll on you if you don't really guard yourself and take care of yourself during that process.
The only thing that I would add is just, and this is something that Dr. Panchal could add to it. Schooling is not just medical school. I mean, you still do schooling today, right?
Yeah.
You're
Yeah.
learning. So you gotta want to learn. You gotta want to read. You have to do a lot of things. So if that's not something you're interested in, and education, I mean, that's part of it. Like if you want to be a doctor, you have to do a lot of schooling. It's kind of like me saying, I want to win the gold medal in the 100-meter sprint, but I'm not willing to go run. It's kind of like one of those things.
Yeah.
So it requires a lot of dedication and training, and it's not the right thing for a lot of people, and that's okay. It's, a lot of people that are doing a lot of things in life that are happy, but again, it's kind of like there's that trade-off, and Dr. Panchal could definitely talk about how much schooling she does even today. Like, even though she's does a lot of fellowships, but even if you don't do fellowships, you still have to. So you
Yeah.
want to talk a little bit about how you do learning?
Yeah, definitely. I think it involves lifelong learning. Sometimes you don't have all that complete knowledge for that patient you're seeing in clinic. So I do a lot of reading all the time on my patients' conditions that come up, because you can't know everything. And even if you did learn a lot in medical school, it doesn't stick in your brain a lot of the time unless you keep seeing it over and over and you work with those kinds of patients a lot. And so constantly I'm doing reading, like every day, on my patients, and like, this they came with this kind of thing. Shoot, I don't remember that medication side effect. Let me just double check and look that up, or something else might pop up. And then I do a lot of, you just have to have that growth mindset and lifelong learning mindset. I know, like in my spare time, I do reading all the time, right? So I read lots of books, and I love that. But I also have to read for this integrative medicine fellowship still. And that's a lot of reading. It's like a 3-year program, and lots of stuff online. And then you have to keep up with the latest research in medicine too. So you have to read on that. So that's where those research skills can come in handy if you do decide if you do want to do work in a research lab or that kind of thing. Oftentimes you have to be self-motivated, and you have to look things up a lot and look up new research papers and all of that. But all those skills come in handy, because it's just, a lot of reading and learning all the time. You're basically a lifelong learner. And you have to do exams all the time. So it doesn't end after the MCAT, and doesn't end after the board certification. You also have those USMLE step exams. But then you also have to do these large exams every 10 years to maintain your board certification. A lot of reading. They've changed that. So for some of the specialties, they say, we'll just change it and make it lifelong learning kind of model, where you have to read like 40 research papers and take exams on that every quarter or something. So now we're doing that. So basically, you keep reading and you have to read a lot and keep learning. So it's not for the faint of heart. It doesn't end with medical school and residency.
Any other questions? This is your chance. I could always reach out to her, so I don't want to keep keep. All right. Well, since we don't have any more questions, we're gonna let Dr. Panchal go. It's a Friday afternoon, so I'm sure she has a lot more reading and
Yeah, more reading to do. But thanks for having me, and yeah, thank you.
more notes to write, right?
Yeah, more nights to write and
Notes to write, yeah.
Yeah. But thanks for having me, Jubin, and hope all of you found this helpful. Thanks for your time.
Great seeing you.
Great seeing you too. Goodbye.
Bye. All right. Gonna keep it open. I'm gonna keep this open for a minute. Anybody wants to download those MCAT books for free, go ahead.